the Schilling test. So to begin with the Schilling test, we need to know that the Schilling test is done to determine the cause of the vitamin B12. So we need to know the cause of the vitamin B12 deficiency. It involves administering of the radio-labeled B12. So you administer the radio-labeled the B12, followed by the 24-hour urine sample collection. So you also do a 24-hour urine sample collection, and the test is repeated with an additional component that can be promoted. So it is repeated. So the test is repeated with an additional component that can promote the B12. So it is repeated with additional component which increases the vitamin B12 absorption. And if additional component is able to correct the defect, and see if it is positive, that is the additional component, it is able to correct the defect, and the radio-labeled vitamin B12 is absorbed, and the vitamin B12 is absorbed. It will be detected in the urine. So it is seen in the urine. Now let's go to the protocol. So in terms of the Schilling test, we are first looking at the stage, and we'll see how it continues. So first is the stage 1. So in terms of stage 1, there is a oral radio-labeled B12. So there is a oral radio-labeled B12, and this is along with the IM dose. So it is along with the IM dose, and this is of unlabeled B12. This is of unlabeled B12, and this is to saturate the liver stores. So it is saturate the liver stores. So after this, we look at the 24-hour excretion of the radio-labeled B12. So in terms of the 24-hour excretion of the radio-labeled B12, so here we check if this is greater than 10%. So if it is greater than 10%, the inference basically means there is a malnutrition directly. And in case if it fails, that is if it is less than 10%, what is to be done? So in terms it is less than 10%, what we do is, if it is less than 10%, we move on to the stage 2. So under the stage 2, we have the oral radio-labeled B12. So under stage 2, there is oral radio-labeled B12. So under the oral radio-labeled B12 and the intrinsic factor, that is IF. So in this stage 2, we look for if it is greater than 10%. So if it is greater than 10%, the inference means it is pernicious anemia, that is PA, and this is the intrinsic factor deficiency. And what if it is less than 10%? So if it is less than 10%, we move on to the stage 3. So under stage 3, we look for the oral radio-labeled B12. So there is a oral radio-labeled B12. So oral radio-labeled B12 along with the antibiotics, and this is nothing but we do a 5-day course. And here what we do is we again check for, in stage 3, we check for if it is greater than 10% or it is less than 10%. So in case if it is greater than 10%, we go for the small intestinal bacterial overgrowth. So this is what is done. In case if it is less than 10%, what is done? So in case it is less than 10%, we move on to the stage 4, S4. So in case of stage 4, what we have is, again we have the oral radio-labeled B12, and we have a recombinant pancreatic enzymes. So in terms of the recombinant pancreatic enzymes, we need to see if it is greater than or less than 10%. So when we look at if it is greater than 10%, what is done? So in case it is greater than 10%, we suggest it is the inference is the pancreatic insufficiency. is pancreatic insufficiency, which can include due to the cystic fibrosis, or it can be the chronic pancreatitis. Next, we are going to look at if it is less than 10%, what is it? So in case it is less than 10%, we consider other ileal diseases. So you can say it is other ileal diseases. So this was about the Schilling test. So we saw the definition of Schilling test and the procedure, how it is carried on. And we also discussed the different stages and the inference after a 24-hour urine excretion of radiolabeled B12. So to learn and grow daily like this, please do subscribe.